spirit of life calling.
Breast cancer has been known to mankind since ancient times. It has been mentioned in almost every period of recorded history. Because of the visible symptoms, especially at later stages, the lumps that progress to tumors have been recorded by physicians from early times. This is more so because, unlike other internal cancers, breast lumps tend to manifest themselves as visible tumors. Earlier, however, it was a matter of taboo and embarrassment that meant detection and diagnosis was rare.
Cancer is a disease that attacks body cells. It attacks any part of the body. So cancer is normally named according to the site where it has developed.
When the cancer is in the breast, then the person who has the cancer is able to feel something in the breast and know that they have a problem in their breast. So if this cell in the breast becomes abnormal and begins producing other abnormal cells, which are cancer cells, the person eventually develops a swelling in the breast. So when they come to the hospital and we test these cells in this swelling, we confirm that actually the cells became cancer cells. Therefore, the person is suffering from breast cancer.
The mention of breast cancer in literature beyond medical journals and books was rare. Involvement of more women and actively bringing out the disease into the open is a recent phenomenon that was around 3 or 4 decades old.
Amagezi gempa abakyala oba abantu bonna gakugenda kwekebeza kansa oyoko ogende bakujjanjabe eddagala yeriri naye abantu beereeyo ne tulimbagana mbuteri eddagala lya kansa era nze nkubiriza abantu bonna bagende babajjanjabe endwadde ya kansa.
Aya abandi tubaye tuli awo ngezira kintu kyona kyona kyetukola kitu aya nga bwomaze otubabulamu mpe ana atunda kuba baki bagumu omuntu okumana nti kino kintuuse ku kandi numukewa mu ddwaliro nga kwima omwasoma obulwairo aya osobola okuyida mu ddwaliro nga wano ati kinanka ibere erikwaliti ayi mbakuwa empiso mamakenda gagano gyogule nga bwogirako ekyo ekirwairo wekikola ki wekikula
Yebakukebera nibazuula ng'olina kansa nibakuzuula amangu kansa awona kuba ife tubaire tuyidi nti kansa tawona.
In the 1990s, the symbol of breast cancer, the pink ribbon, brought out a revolution against this cancer.
Kansa lumbe rubi luyita omuntu. Kansa oyo akulya nga toyidi akugema toyidi yasigala mulenga atambula nga ali kulya nga toyidi.
Yeah, it's good to test earlier so that it doesn't develop so much or spread to the rest of the body. And this test you can either do from the hospital, you can even do it yourself.
In this developing country, where 40% of the people live on less than $1 a day, cancer education and screenings are rare. Diagnoses come late and treatments are often not available.
Breast cancer is really a deadly disease and it can be treated if you detect it early. Yeah.
Breast cancer has claimed lives of many women around the world from all age brackets.
Especially if it's not detected early and it spreads to the rest of the body, it kills very fast.
At last count, in 1998, Uganda had only 2 radiation units, 1 chemotherapy unit, and only about 5% of cancer patients had access to the facilities. Statistics indicate that median age of person diagnosed with breast cancer in Uganda is 45, and for a cervical cancer diagnosis, it is 43.
And breast cancer is curable. Breast cancer can be screened for. We can check for it and catch it early.
The prognosis for most Ugandans with cancer is poor. Only 45% of breast cancer patients and 18% of cervical cancer patients survive 5 years after diagnosis, in part, researchers believe, because their cancers are diagnosed at late stages. Among Black Americans, the 5-year survival rates are 75% and 66%. This is the disease that is slowly eating up the Ugandan population, with at least 1 in every 500 people suffering from a cancer. That figure is rather worrying. Statistics, doctors say, have shot up recently due to many factors ranging from an increase in infectious diseases in the region, changing lifestyles, and perhaps an increase in awareness among the population who cannot report cases at the hospital rather than die unnoticed in shrines and the likes.
We are seeing this cancer on the increase day by day, probably because of the lifestyles that we lead.
Smoking tobacco appears to increase the risk of breast cancer, with the greater the amount of smoking increasing the risk. Early in life, smoking has been observed to heighten the risk of such that among those that are long-term smokers, the risk is increased 35% to 50%. A lack of physical activity has been linked to 10% of the cases.
There are those habits that I like talking about: smoking, delaying sexual activity, so that we avoid this human papillomavirus and HIV and all these other things, because those are things that we can control about. Doing exercise, or at least doing physical activity. If God has blessed you and you have a car, you move while seated, make sure it's part of your lifestyle to do exercise. You can decide to always walk from work to home. Walking to work may be difficult because you're rich and you're sweating, but walk from work.
Cancer can be traced to medical conditions. Certain breast changes, atypical hyperplasia, and labor carcinoma in situ found in beginning breast conditions such as fibrocystic breast changes are related with an increased breast cancer risk.
Many people in our communities believe that once somebody has cancer, then they should write their will and just wait for their day the next day. But one piece of information that we all need to know is that actually cancers are curable. Now, even if cancer is advanced and it cannot be cured, we can't say, this one we are going to cure it. Cancers can actually be treated and controlled and symptoms taken away, and people can live comfortable lives.
We need you and your skills. We are looking for volunteers in health, nurses, doctors, fundraisers, oncologists, and proposal writers. Thanks for your financial support towards the mobile clinic and an ambulance project in Uganda. Cancer Support Uganda. Help cancer patients stand on their feet.